This proposal is a collaboration between a medical microbiologist, a pharmacist, a behavioural psychologist, and an information designer. We employ two different approaches to help address the problem of combating antimicrobial resistance in the pharmacy space. Our two approaches are pharmacy users intervention, aimed at increasing self-care and prevention of self-limiting infections, and pharmacy staff intervention, aimed at increasing antimicrobial stewardship advice given by pharmacy staff. We have suggested a campaign that uses messages linked to products on sale in the pharmacy to areas of the body. We aim to nudge behaviour with nuggets of self-care advice. We have called it Love the Skin You're In. It focuses on things people can do to get better on their own. We are modelling our ideas at the Day Lewis Pharmacy in Woodley. Love the Skin You're In is a flexible, temporary campaign which could be matched to peaks of different infections throughout the year. The campaign transforms the pharmacy space with hanging flags. The flags help direct pharmacy users to different self-care products. A secondary level of hanging flag offers syndromic advice. And a third level of hanging flag provides our love messages. They are nuggets of advice challenging commonly held assumptions, given at a point when patients are seeking self-care products. We have identified 8 potential locations at the Day Lewis Pharmacy, including respiratory products, insect bite products, and bladder products. They link to 8 self-care messages that help to reduce the use of unnecessary antibiotics in Woodley. Children and adults can collect the love message stickers and complete the Love Your Skin campaign while they browse or wait for prescriptions. A completed sheet wins a sticker to stick on our Woodley Warrior. After a week or two, the Woodley Warrior would be able to give us a picture of the understanding of self-care in Woodley. Our second intervention is aimed at pharmacy staff and users. It focuses on improving antibiotic stewardship advice in community pharmacies such as Day Lewis. We suggest a checklist on the wall in the pharmacist working area to remind the staff to offer advice with patient prescriptions. The checklist increases the likelihood that staff will give advice in line with the 10 Royal Pharmaceutical Society principles. We suggest a checklist on the wall in the prescription working area to remind pharmacy users to ask for self-care and prevention advice with their prescriptions. This advice is in line with the Royal Pharmaceutical Society guidelines. We repeat the advice on the prescription bags. During the campaign, the bags could also be printed with the campaign logo or other national campaign logos. An important part of the campaign is feedback about advice given by pharmacy staff. It helps motivate pharmacy staff to give advice in line with the checklist. This feedback will count as an audit, helping the pharmacy to fulfill the Healthy Living Pharmacy criteria. We believe our two interventions together are likely to make a substantial difference to antibiotic use, as the components are evidence-based, cheap to implement, likely to have a high uptake due to the easy messaging and motivational components.